Welcome, everyone, and good afternoon. We're here today to talk about the NIDEC F10 scanning laser ophthalmoscope retinal imaging system. And this is indeed a very powerful retinal imaging system that we've been working with at USC for the past 6 months. I'd like to acknowledge the work of our fellow, Leanne Labriola, and my two colleagues, Alex Walsh and Vas Sada. So, a couple of things. First of all, the F10 is a unique multifunction system. It includes a color imaging system that is entirely SLO-based, and this is unique in the marketplace. It provides the capacity of doing red-free imaging, autofluorescence, simultaneous angiography, both fluorescein and indocyanine green, and it has a whole set of unique capabilities revolving around infrared, red, and blue reflectometry, including the ability to use retroillumination mode and other image processing techniques to show the clinician quite graphically the pathophysiology of the disease entity that they are confronting. NIDEC also has a microperimetry system, and we can overlay the microperimetry data from that system upon the F10 flawlessly. As you all know, the scanning laser ophthalmoscope was introduced by Webb in 1979. It is a confocal imaging system which uses the eye as its objective lens, and it permits the ability to do multi-plane imaging of the ocular structure with high resolution. This system is unique in that it employs 4 lasers: an infrared laser at 790 nanometers, a red laser at 660 nanometers, a green laser at 532, and a blue laser at 490. And this unique combination of lasers permits the device to do multiple things. As you can see here, where we have on the top a 790 nanometer image, a 660 nanometer image, a 532 nanometer image, and a 490, the power of monochromatic imaging is fully embraced by this device. The system includes not only 5 confocal apertures, as in a traditional scanning laser ophthalmoscope, but 3 ring apertures, which I will discuss in a moment. The confocal apertures have a central opening, and the ring apertures really block the center. We'll go over that. Now, this is a patient from my practice at Doheny, and you can see these are conventional color fundus photography. 20/60 in the right eye, 20/25 in the left. Patient symptomatic for a number of weeks. And the OCT shows a rather small macular hole. Now, we can look at this. This is an image from an infrared image from the F10, showing very dramatically the patient's Weiss ring, showing the tremendous depth of focus and the ability to actually image the vitreous. This is really the first system that we've fielded in the clinic where we can actually image the vitreous in a clinically reproducible way and a way in which we can record. And you can see here the blue laser image, which is superficial. You can see the macular hole very well shown on the infrared laser image and pretty well on the monochromatic green image as well. And so functionally, the 4 wavelengths that we have. The blue laser is used for excitation in fluorescein angiography, for fundus autofluorescence, and for imaging the retinal nerve fiber layer. The green laser is what we use for red-free monochromatic imaging and for getting good vascular contrast. The red laser is used for fixation and imaging the choroid, and the infrared laser at 790 nanometers is also available for fundus autofluorescence and retro mode illumination of the fundus. And you see those imaging capabilities depicted graphically on this image of the retina and choroid. So, a number of examples. Let's look at macular degeneration. Here, a patient with drusen. And the capability of this device is well illustrated here. One of the great challenges in developing an integrated imaging system is the ability to generate a color fundus photograph without using a camera, essentially. And this system has done very, very well indeed. This F10 image on the upper left is, in fact, a color fundus photograph that is really of high quality. You have an infrared monochromatic image below, and then we can see something that has been described by a number of investigators that have had this system, which is the capability of retroillumination. Here, we're using infrared light, and we are observing the shadowing by pathologic structures of the light. And so here we see, actually, in a very dramatic way, the abnormalities in the retinal pigment epithelium consistent with drusen. This really looks very similar to the RPE map generated by a SD-OCT system. And we believe that this capability should be correlated with SD-OCT systems and will become, I think, a useful tool in very quickly looking at a patient's eye and understanding pathophysiologically what's going on. There's really no way to look at this in a planar system and see this. The only other way you could have seen this in the past is by using an SD-OCT and then doing a mathematical reconstruction. So very simply, you can do this. Now, we're using really a non-mydriatic function in the near infrared. So these images here can be achieved in a non-dilated pupil. Retro mode identifies early changes, shows the full extent of the lesion, and one of the observations that was made at ARVO over the last 2 years is that the color fundus imaging, looking at traditional fundus imaging, is probably not the best way of detecting drusen. We know that because we've heard about the work using OCT. So here is the confocal apertures on the top, which is the traditional approach for multiplanar imaging. The ring apertures, however, you see, block light centrally and left, center, and right, and those ring apertures are what we're using to optically create the retro mode, and that's unique in this system. This is an eye with subretinal drusenoid deposits that are very well illustrated on the right, left, and center apertures. And this is the SLO image, which you see on the left. The confocal image reflects one plane of light, but in the retro mode, all the retinal layers create shadows to the light coming from the fundus. So it really gives you a pseudo 3D that really shows you the extent of the pathology in a very direct way. So we believe that this technology is something. This is the first fundus imaging system that really has incorporated this technology, and there really is a rationale for using this. In the traditional TopCon or OIS imaging system, those systems can do the imaging using angiography, but don't have any of these other retroillumination tools. This is really a great case that illustrates this three-dimensionality. This is an eye with retinal angiomatous proliferation, which, as you know, is a variant of choroidal neovascularization. You see the flecks of intraretinal blood on the fundus image, and you can see below, actually, the extent of the detachment of the RPE. Here, very dramatically shown on this retroillumination mode. It really is quite remarkable, and we can correlate this with the OCT. In fact, in some sense, you can almost see the cysts, the intraretinal cysts, which we see on OCT, in this en face view. So you have a very excellent way of instantaneously, clinically, looking and seeing the extent of the retinal pigment epithelium. So as we treat patients, this will be an excellent way of looking at treatment effects. Here is another case, here with a fibrovascular PED. This is the OCT on the top, showing this solid fibrovascular lesion with an overlying neural retina without much edema. And you can look at this retro mode illumination, particularly with the ring aperture, that shows you the extent of the pigment epithelial detachment seen there. This is an eye with a classic choroidal neovascular membrane seen here. This is the color image. And sometimes you do get a little bit of a greenish tint, rarely, but it does happen. Here you see this image. And looking at one IR image of the fundus, this is a retro mode. Once again, you can, by looking at the retro mode, you know this patient has a retinal elevation, a detachment of the pigment epithelium. And you can see this on this is the correlation with the OCT. And we'll show you the section. There is the PED, which is correlated with the retro mode image that we saw in here it is, right there. So this is the first time we've been able to see this kind of pathology en face. And here this is a color OCT and the retinal thickness map. But you look at this retinal thickness map that we achieved through extensive image processing, correlates extraordinarily well with the retro mode infrared imaging system. So this is a very powerful tool. You can superimpose, here what we've done is superimpose the OCT image on top of the retro mode image to illustrate the correlation. And of course, this is really a terrific angiography system, which we use. You can see here, it's a nominal 45-degree angiogram. Our photographers like using it. You can get an expanded image to 60 degrees with an optical adapter, and the quality is really quite excellent. And we can do ICG as well. Here on the right, you see the fluorescein angiogram, and here the ICG. So quality excellent, and this one of the great advantages of all SLO-based angiography systems is the ability of simultaneous photography with injection. Now, one interesting optical processing feature of the device is what we refer to as differential contrast ophthalmoscopy. And here you see the fluorescein and the ICG, and with the image processing that is embedded in the system, you can actually create images which depict very graphically the underlying pathology. Here you can see the choroidal neovascular membrane as if it were elevated under the surface of the retina. And in the ICG, you see the corresponding ICG hotspot, also depicted in a three-dimensional fashion. We looked at a number of eyes with retinal dystrophy. This is the infrared F10 confocal compared to green light filter autofluorescence. First of all, you can see a much larger field of view, and it really correlates with the pathology seen on the color photograph. This is a green light filter autofluorescence on the bottom. There was a paper in the American Journal of Ophthalmology in May from Japan. A number of Japanese investigators looked at retinoschisis, and they did a detailed correlation of retinoschisis with OCT and F10 confocal. But there is a very characteristic fingerprint pattern which shows the extent of the retinoschisis, and the change in the direction of this pattern indicated interretinoschisis. It is said that this central circular defect around the fovea is correlated with a lamellar macular hole. So once again, the only other way of really getting any kind of quantitative 3D data about this system is through OCT, and this is in a much more dramatic way. It's a powerful tool for looking at macular edema. This is an eye with a branch vein occlusion and macular edema. And these are monochromatic images and a retroillumination image that shows this area of macular edema, which correlates with the OCT map macular edema and the cross-sectional area. Diabetes. A variety of interesting patterns have been identified using the retroillumination mode. This is a green monochromatic view of this eye with diabetic macular edema. And here we see a infrared view and another view with this stippled staining pattern. And finally, a retroillumination view showing this eye with diffuse macular edema. And here is the thickness map. So Paravano looked at diabetic macular edema and found a number of unique patterns: honeycomb, petaloid, and diffuse. The Italians, Medina from Padua, looked at cystoid OCT patterns and macular volume and correlated that to retro mode imaging. And another study, also from Italy, looked at the F10 image and correlated this with the extent of edema. These are a very interesting set of images from a patient with, I think you could make the diagnosis without the OCT, central serous choroidopathy. You see here on retro mode the retroillumination, the appearance of the elevation of the retina, and actually in this situation, you can, with the IR viewing, you can actually see the vessels. Correlated here with a traditional OCT showing a defect in the pigment epithelium, which, guess what, you can actually see here without any dye. I will circle those for you. There's the line, and there are those three images showing you what's going on underneath the retina. Very powerful tool. This is a patient with bilateral serous retinal elevations associated with a systemic agent. And these are they look like ICG angiograms. Actually, they're IR IR retroillumination images, IR photographs, showing areas of leakage. You can see these look like ICG hotspots, but they're actually achieved and imaged without dye. So the choroid vessels are seen using the ring aperture, which I discussed earlier, and you really can detect choroidal hyperpermeability, it would appear, using this approach. This is a case of vitreous syneresis, and you can really appreciate the degree of syneresis. We can play this video again. So we believe this will be a useful tool in looking at the vitreous. A couple of the unique technical features of the F10. There's a spinning mirror which goes at 35,000 revolutions per minute. It produces extraordinarily high-resolution images at 10 hertz, 1600 by 1200. So the image quality is excellent, and we can achieve between 10 and 26 scans per second. As we go to a lower rate, we get higher quality, and it really is quite dramatic. So in summary, the advantages of the F10. We can highlight pathology in unique ways. We can obtain images from various layers of the retina, vitreous, and choroid. We can have high-quality fluorescein and ICG images and videos. It is indeed non-invasive. It is wide field, so we're looking at the entire extent of the macular lesions. Quick image capture time, non-mydriatic images, particularly when using the IR mode, and it is extremely useful in patients with poor fixation. Thank you very much for your attention. So we have time for a couple of questions. Dr. Rochelle.
So you can do ICG videos with this?
Yes.
For feeder vessels?
Yes.
And how difficult is it relative to the other SLO systems for doing that kind of vision?
I think it's easier. You know, the other system that we have is the Heidelberg. I think the photographers think this one's easier to use. And of course, you don't, one of the advantages is with the Heidelberg, you can't get a color photograph. So here you've got the color image, and you can do both ICG and fluorescein. And you've got the retroillumination, which provides you with sort of an instantaneous pseudo 3D image processing about what's going on in the retina.
And you can do simultaneous fluorescein and ICG?
Yes, yes. Other questions? Yes?
So would you have to do the OCT also?
Yes.
You have a support with the OCT?
What's that?
I mean, you always have to do the OCT and this technique? I mean, use this kind of equipment, and also the OCT to get the whole thing?
It doesn't replace the OCT, but what it does do is provide you with those 3D imaging of what's going on with the neural retina and the pigment epithelium in a direct way using the fundus imaging system. And for instance, if you have only a Stratus OCT, you really can't get that 3D imaging because time domain OCT doesn't provide that for you. So if you have a Stratus, only a Stratus, this is a tremendously valuable tool. And you can, as you can see, we can correlate the OCTs with the imaging, with the images as well.
So this machine is obviously not producing an OCT image itself?
No, it is not. Ultimately, I'm sure it will. Because really the power here is that this has got everything except the OCT. But almost everyone has an OCT. This makes a tremendous amount of sense if you're buying a new angiography system. So the competition for this is the Topcon or the Heidelberg. If you already have an OCT and you need another angiography system, this is a device with lots of value-added features that people are that the imaging researchers are really just starting to understand. Yes.
What about interface with EMR? You know, document management. How is this system? Because the Heidelberg system is selling it. You know, for their data.
There's a software package called Navis that's the data analysis and imaging software, and I think it's good. Gary maybe has a comment about that.
Just a comment. We were 5 EMR systems already connected up to that. So it's ready to roll. I mean, we've been working with them for over 6 months now.
Yeah, we're planning on putting it, we're putting in an electronic medical record system at USC, and this is one of the data systems that are going in. All right, well, thank you very much for your attention, and we're going to be around to answer all your questions, and we have a computer simulator and some nice handouts out there and some refreshments. Thank you, everybody, for coming.